the Florida Department of Health, in partnership with the governor, is going to be working to end all vaccine mandates in Florida law. All of them. All of them. And that's how it should be. That is a moral, ethical universe, not this nonsense where people who don't know you are telling you what to put in your temple.
This would make Florida the first state to end a long-standing and constitutionally upheld practice of requiring certain vaccines for school students. Joining us now to discuss is Dr. Megan Martin. She's a pediatric ER physician in Florida. Thanks so much for being with us, Dr. Martin. What do you expect is going to be the impact of Florida's decision here?
You know, I'm concerned about the decision. Vaccines, we have really great evidence and really great science that they are effective to reduce the burden of illness and honestly even reduce deaths in the pediatric population, especially things like influenza, measles, pertussis. So vaccine mandates are a way to improve adherence to the vaccine schedule. And I think we all want the same thing. We want kids to be healthy. And this is one very evidence-based way to do that.
The Surgeon General of Florida made a comment about vaccine mandates that stuck out to me, and I just wanted to get your reaction to it. He said that every vaccine mandate is wrong and drips with disdain and slavery. I mean, what is that about?
You know, I'm not sure what that's about at all. Vaccine mandates are present in every state. We have really good long-standing evidence for decades that vaccines are effective. We have really good safety profiles for them. So I think that it's really important to look at the evidence when we're making these public health decisions. And especially for us pediatricians who work with vaccines every single day, we will continue to work with public health officials to do the best thing for the kids in our communities.
Now that summer is wrapping up, Doctor, and we get into the colder months and more people are indoors, we're anticipating that, as always, there's going to be a resurgence in the numbers when it comes to things like the flu and COVID, potentially measles as well. I'm wondering what specific diseases or conditions are on your mind, and are you particularly concerned about when it comes to students that are going to be in classes now and into the future where there are no mandates on vaccines?
Yeah, so I'm a parent, and I'm sure a lot of the people out there are parents as well. And I think there's one thing that we know about schools. They're learning a lot, but they're also sharing a lot of germs. And this time of year especially, you know, we're looking at the respiratory illnesses like influenza, RSV. We'll likely see some COVID, and then some of the other things like human metapneumovirus and adenoviruses. It's really important that we do the best to decrease the amount of illness in our communities. There's plenty of vaccines out there that can help us with that. There are certainly not enough pediatric beds when we see these big outbreaks of illnesses, like when we saw the triple-demic a couple years ago. So trying to keep kids out of the hospital and healthy is always our goal.
Do you think that this step by Florida, if other states go the same direction, it might alter the demand for vaccines and perhaps in such a way that it could affect their supply? How many are being produced and put out there?
You know, I think that's something that remains to be seen. I'm concerned because it's really important to have good vaccine adherence so that we can decrease the outbreaks in our community. I'm concerned that other states could potentially follow suit, and then we could have decreased adherence around the country, which again could open us up. We saw the measles outbreak this year, more cases than we've seen in 30 years, over 1,400 people sick, many hospitalized, and unfortunately some people that passed. We can decrease these by kids getting vaccinated.
Dr. Megan Martin, we'll leave the conversation there. Thank you so much for the time and expertise.